Okay, so welcome back for this lecture on aneurysms, and we are going to be talking about what aneurysms are, who is at risk of aneurysms, how are they investigated, or how do we find out that actually someone has an aneurysm, what are the common places where we have aneurysms, and basically what the manifestations of aneurysms are, yeah? Now, if I may just ask, can you ponder about the definition of an aneurysm? Yeah, and remember we are talking about cardiovascular conditions, and strictly we are talking about those ones that affect or interfere with the arteries. Yeah, and so aneurysms, or an aneurysm, is basically a dilatation. Yeah, or a distension or an enlargement, yeah, also referred to as an outpushing of a vessel, not only a vessel, but also the cardiac chamber. Yeah, this is what we mean. Yeah, if you have your artery, yeah, if you have your artery like that, yeah, and this is the lumen, yeah, this is basically the lumen, yeah. And this is the lumen of your artery, yeah. So with an aneurysm, we mean that we have it basically pulge, yeah, or we have it dilate, yeah, to something like that, yeah. So that is basically what we refer. Ideally, it would be passing around there, as you can see, yeah. But we have an extra portion or a dilatation within the blood vessel, and that is what we refer to as an aneurysm. Yeah. Now, it does not only happen in blood vessels, but it can also happen within the cardiac chamber. Yeah. And this is what we are talking about. Assuming this is your heart. Yeah. Assuming this is your heart, you have that is your right atria. Those are your valves, and then you have basically something like that, yeah? Now, with an aneurysm, just imagine something happens, like, for example, ischemia, or maybe a myocardial infarction, yeah, at around this place, yeah? So what actually happens is that if this place is destroyed within the heart, yeah, what actually happens is that it heals, yeah, just like any tissue that we have in our body heals, yeah. Even the heart muscle, when damaged, it heals, yeah. However, the healing, or what actually happens is that the healing of the muscle does not, yeah, the part that comes after healing does not have the same properties as the rest of the muscle of the heart. What actually happens is that this part is replaced by things like fibrotic scar tissue, yeah, which is weak and is unable to maintain contractility of the heart. As a result, what actually happens is that if the heart keeps on pumping, yeah, if the heart keeps on pumping, what actually happens is that with time, this part of the heart dilates, yeah? In other words, it makes a portion, yeah? It makes a portion, and that is what we refer to as an aneurysm within the heart chamber, yeah? So whenever you define an aneurysm, it is said to be a localized dilatation or an outpushing of a blood vessel, yeah? And mostly we observe this in arteries, especially the aortic, you know, the aorta, right? And then not only the blood vessel, but the cardiac chamber, as demonstrated here, yeah? I hope it is clear. Now, so let's talk about when you want to understand aneurysms, yeah, there's a law that you need to understand, yeah? And that law is none other than what we refer to as Laplace's law. Yeah, Laplace's. Now this law, you'll find it quite often, yeah, especially when you're doing your physiology. Yeah. Now this is Dr. Laplace was a physician, yeah, who came up with this law, and you know it is as simple as you know the tension, yeah, the tension, you know, as blood flows within the blood vessels, the tension that is within the blood vessels is directly proportional to the pressure and the what? The radius, yeah? So the tension within the blood vessel, yeah? In other words, we are saying that the tension, yeah? If this is our blood vessel here, yeah? The tension, yeah? The tension that is within this blood vessel, yeah? The tension that is within this blood vessel, is directly proportional to the pressure, yeah? The pressure here, assuming this is our blood vessel, yeah, and assuming this is our blood vessel, and you know that, so we have pressure within the blood vessel, yeah, so we have pressure within the blood vessel. So this tension, yeah, this tension within the blood vessel, yeah, this tension within the blood vessel is directly proportional to the pressure, yeah, the pressure and the radius, yeah, and the radius of the blood vessel, yeah. Now, what actually happens is that during a dilatation, or when you have an enlargement, yeah, what actually happens is that you have imagine this is the pressure here, pressure, and then the tension, yeah. So what actually happens is that when the tension, you know, when we have a dilatation, generally the radius increases, yeah, as you can see, yeah. When you have a dilatation, the radius increases, yeah. And that pressure, yeah, that pressure that was basically there to support this enlarged, you know, blood vessel is not sufficient, yeah. What actually happens is that the pressure will in turn increase, yeah, because of the increment in the radius, yeah. The pressure will in turn increase, leading to an increase in tension, yeah, leading to an increase in tension. And because of that, we shall have this pressure increasing as the radius generally increasing, yeah. So what actually happens is that the radius keeps on increasing, yeah, and because the radius keeps on increasing, yeah, the pressure also increases as well, yeah. And basically it goes on and on, yeah, until there is a remedy, or until this until there is probably a bursting of this blood vessel. Now that is what we refer to as Laplace's law. Now I will request you to read more about it, yeah, and also to understand it better, you will also want to read about the Franklin-Starling law, yeah. These two laws are very, very important as far as the hemodynamics of blood vessels is concerned, yeah. Right. So after talking about Laplace's law, we want to talk about the types of aneurysms, yeah. Now, we have what we call true aneurysms, yeah, true aneurysms, and these true aneurysms, yeah, these true aneurysms basically involve all the three layers of the blood vessel, yeah. Remember, we have the media. Let's start with the intima, yeah. Intima. intima, yeah. Then we have the media, and then the external. So with the true aneurysm, yeah, we have with a true aneurysm, we basically have all the layers, yeah, layers of the blood vessel involved, yeah, and most of them are fusiform, as you can see, fusiform on both sides, yeah, fusiform on both sides, as you can see in the diagram, or they can be circular, yeah, fusiform circular, yeah. So fusiform circumferential or fusiform circular, as you can see in those diagrams there. But the point to take home here is that with the true aneurysm, we have all the three layers of the blood vessel involved, yeah. Now, on the other hand, we have what we call a false aneurysm, yeah. We have false aneurysms. Now, how do these ones come about? Imagine you have a blood vessel, yeah. Imagine you have a blood vessel, and this is our blood vessel. This is our blood vessel. So this blood vessel here, has all the layers has all the layers, yeah, that we are talking about now. Now, what actually happens, since blood is usually at a high pressure, yeah, blood within the blood vessels or within the atria is usually at a high pressure. Now, what actually happens is that there can be a kind of like a dissection, yeah, a dissection whereby the inner blood is rather the inner layer is destroyed, yeah. So what actually happens is that blood enters, yeah, blood enters that layer, and therefore creating or leading to this area to basically expand, yeah, leading this area to basically expand, like probably like that, yeah, as a result of blood entering that layer, yeah. Now, we refer to that as a false aneurysm, yeah? And this is basically an extravascular hematoma that communicates with the intravascular space, yeah? So because blood has left, so you have this hematoma communicating with the intravascular space, yeah? And the common cause of this type of lesion is a leak between the vesicular graft and you know, a natural artery, yeah, in patients who have had grafts, yeah, and the common example here that has been given is a dissecting circular aneurysm, yeah. Now these are false aneurysms because they do not involve all the three layers of the blood vessel, of the artery. I hope you understand that. Now, this is an example of a thoracic aneurysm. You can really see you know, the change or the dilatation in this blood vessel. Now, what causes aneurysms? What are the causes of aneurysms? Yeah, is what we are going to talk about now. Yeah, one of the causes of aneurysm is that atherosclerosis. Yeah. Now, atherosclerosis, this is basically, these are a series of events that basically come about to bring about, you know, we shall look at that, yeah? We shall look at this, but usually with atherosclerosis, basically begins with, you know, you have a blood vessel, and in this particular case, we are having an artery, yeah? So we have a blood vessel. Remember, it has an intima, it has an inner layer, yeah? So when the inner layer is damaged, yeah, when the inner layer is damaged, what actually happens is that since it is damaged, chemical mediators are basically released, bringing about you know, platelets to this area, yeah, and other cells, yeah, cells of inflammation, yeah. So what actually happens is they end up corroding or they end up weakening this layer, yeah, this intimal layer. and as a result bringing or causing or bringing about a weakening in the blood vessel wall, leading or bringing about an aneurysm. Yeah. Now, the other one is basically hypertension. Yeah, what we looked at earlier. Yeah. So with chronic hypertension, this one results in mechanical shear forces that basically contribute to remodeling and even weakening of the blood vessel. Yeah. Remember, we said hypertension is sustained arterial, sustained arterial blood pressure. Yeah. So when it is too much and it is sustained, it basically leads to weakening of the blood vessel, and as a result, leading or bringing about aneurysms. Yeah. Now the other condition is syphilis. Yeah. Now syphilis is one of the diseases that is basically sexually transmitted, and it follows a chronic kind of inflammation. Yeah. Whereby the cells that are involved in chronic inflammation are basically macrophages and lymphocytes. Yeah. And plasma cells. Now, when these ones concentrate in an area, they basically cause or bring about weakening, yeah, in that area. Yeah. Now, when they concentrate in a blood vessel, they bring about weakening in that area, and as a result, bringing about an aneurysm. Yeah. We have disorders, genetic disorders like the Marfan syndrome. Now, I want you to read about the Marfan syndrome. Yeah. But it is one of the genetic disorders that basically can bring about aneurysms, yeah, because of the disorders in collagen manufacture. Collagen is very important because most of these walls, arterial walls and blood vessel walls, are made up of collagen. However, if you do not have these in sufficient amounts, then basically you'll have your walls weakened, and as a result, you'll end up with, weakened vessel walls, and as a result, you'll end up with aneurysms. Yeah. Traumatic injury to the chest and abdomen, all these can bring about or can cause aneurysms. Inflammation, with the production of toxic oxygen radicals and changes in cytokines, growth factor, these ones can all bring about, aneurysms. Now, what are the general complications of aneurysms? Yeah. Now, we want to look at the general complication of aneurysms. Yeah. In other words, what can aneurysms lead to? Yeah. So, if I might draw something like this, yeah. If I may draw something like this, yeah. We have a thrombus. We are going to look at that in a minute, yeah. But we have things like thrombus, yeah, thrombus formation, and how does that come about, by the way? Remember, we said that especially with the false aneurysms, what actually even with true aneurysms, by the way, what actually happens is that if you have a blood vessel, yeah, and blood is supposed to be flowing like that, yeah. So the blood that basically, gets stuck, yeah, there, yeah, can end up, bringing or clotting, yeah, can end up clotting, and as a result lead to formation of thrombi, yeah. In other words, thrombus is basically clotted blood, yeah. So the blood that basically outpouches usually ends up clotting, and therefore leading to formation of thrombus, yeah. Now, the other one that is basically of importance is what we call an embolism, yeah, or embolism or embolus. Now, an embolus is basically is a thrombus that basically moves, yeah. In other words, if you have a piece detached, if you have a piece of this thrombus detached, yeah, if you have it detached and then it moves, yeah, assuming it moves, yeah, and it gets stuck, yeah, in a narrow blood vessel or in a narrow artery, what actually happens is that it creates ischemia, yeah, because it occludes the blood vessel, and as a result, bringing about ischemia, yeah. So that basically leads to what we, and that is what we refer to as emboli, right? Good. Now, the other one is basically infection. Yeah, infection. And with infection, what actually happens is that, bacteria love media that is basically stationary. Yeah. And you will do microbiology, and you'll find out that, when we do culture and sensitivity, we usually put bacteria on a medium referred to as agar. And this agar medium is usually clotted blood. Yeah, clotted blood. Now, so once we have clotted blood that is basically stuck in one place, it provides a good media or a good medium for bacterial growth. And as a result, you have bacteria multiplying in this region, leading or bringing about infection or sepsis for that matter. Yeah. So that is very, very important. Infection is very, very important to take home. Now, the other one is rupture. Yeah, rupture. The other one is rupture. Yeah. So with rupture, what actually happens is that because remember we looked at Laplace's law. Yeah. With rupture, what actually happens is that if this area rupture, this place can end up dilating, and ends up rupturing. Now that is dangerous, very dangerous. Yeah. And for that case, referred to as an emergency. Yeah. So rupture can also be a complication because of the too much overextension or dilatation of this blood vessel. Then the other one is compression. Compression. Now, how does compression come about? Now, this comes about because when you have dilatation, yeah, this place that dilates usually compresses the adjacent structures. Yeah, it compresses the adjacent structures. Take an example of the thoracic aorta. Yeah, you have an aneurysm in the thoracic aorta. What actually will happen is that it might compress on the esophagus. Yeah, it might compress on the trachea. Yeah, so compression is very, very significant. Yeah, as far as a complication of aneurysms is concerned. Now, so depending on where the aneurysm is, yeah, it will cause compression of the adjacent or the nearby structures. Yeah, so compression is very, very important. Yeah, as far as a complication of aneurysm is concerned. Now, what are the clinical manifestations of these? Yeah. Now, it basically depends on where the aneurysm is. Yeah. Remember, we said that the commonest blood vessel is the aorta, but also the heart. Yeah. So it will basically depend on where the aneurysm is. If it is within the heart chambers, then you're bound to have things like dysrhythmias. A dysrhythmia is basically a dysrhythmia is an abnormal rhythm, yeah, within the heart, yeah. Things like heart failure, things like embolism or clots to the brain or even other vital organs, yeah. So this basically means that you will have it where it is, where the problem or where it is, yeah. Now, aortic aneurysms are usually asymptomatic and until they rupture, yeah, when they become very painful and are usually emergencies, yeah. Now you will also have, in case there is compression of the adjacent structures, like for example with the thoracic aorta, you will have things like difficulty in swallowing because this thing is compressing on the esophagus, yeah. So you'll have things like difficulty in swallowing. You will have difficulty in breathing, also referred to as dyspnea or breathlessness, and these are basically caused by the pressure of the aneurysm on the surrounding organs. Yeah. Now, how is it diagnosed? Usually, it is confirmed by ultrasound, CT scan, MRI, or even angiography. Now, you will know what these investigations mean, but these are basically radiological investigations that are done to detect, whether there is a dilatation or a dilatation in these blood vessels. And by the one thing I should mention is that These are usually detected unaware, when you're unaware, yeah? When you go for like maybe a general checkup and then they end up detecting these, yeah? So, but they are usually detected with radiologic investigations, since most of them are asymptomatic. Yeah? Now, the goals of treatment of aneurysms are basically to maintain a low blood volume and a low blood pressure, yeah, to decrease the mechanical forces throughout, yeah, that contribute to blood vessel dilatation. In other words, we are saying that once you are diagnosed to have an aneurysm, the intention of the treatment is that we want to maintain a low blood pressure. Remember, we talked about Laplace's law, that when the blood pressure increases, or when the pressure within the blood volume increases, it leads to more dilation of the blood vessel. So we want to maintain this pressure as low as possible. Not only the blood pressure, but also the blood volume, yeah? The blood volume, because the blood volume indirectly contributes to blood pressure, yeah? So we want to maintain this as low as possible so that we do not have it escalating, yeah? And therefore ending up causing the complications that we looked at earlier. Now, medical treatment is indicated for slow growing aneurysms, particularly in early stages, yeah, and things like cessation of smoking, reducing of blood pressure and volume, and agents like beta blockers. These ones help with blood pressure lowering, yeah. Now, for those aneurysms that are dilating rapidly, we need surgical treatment. Like, for example, the normal diameter of the aorta is basically about three centimeters. Yeah, but if it goes beyond 5 and 7, then that basically means it needs to be worked on. Yeah, or operated upon. Yeah. And therefore, you will have surgical interventions for this kind of structure. Now, repair should be done when aortic aneurysms reach 5 centimeters in diameter. Remember, we said the normal is about 3. Yeah. Now, the risk for eventual rupture approaches 20% for aneurysms greater than 5. Yeah. And it approaches even more than 50% for aneurysms which are greater than 7 centimeters in diameter. Yeah, so that is basically about aneurysms. And briefly, let's talk about what we call arterial thrombus formation. Remember, we said the thrombus is formed as a result of clotting of blood. Yeah, and so let's briefly talk about arterial thrombus formation, and that will be the end of our lecture. Now, as in venous thrombosis, we also have arterial thrombi, yeah, which are basically formed. Yeah. They develop wherever you have intravascular conditions that basically promote activation of coagulation, or what we call clotting. Yeah. Now, these conditions include things like irritation of the intima, yeah, and roughening or even inflammation. Yeah. Things like traumatic injury, infection, low blood pressures, obstructions that cause blood stenosis, and even pooling within the blood vessel. All these bring about, conditions that favor blood to clots within the blood vessel. Now, thrombi form, yeah, also on heart valves, yeah, as a result of altered calcification or even bacterial growth on these valves, yeah. So valvular thrombi are usually associated most commonly with inflammation of the endocardium, what we refer to as endocarditis, or a condition referred to as rheumatic heart disease. We shall talk about this and what it means. Yeah. Now, basically, arterial thrombi formation can occur in shock, and this can actually result can be a result of or it can result from like, for example, septic shock, or what we refer to as septicemia. Yeah. So in septic shock, you have systemic inflammation which basically activates a clotting cascade. Yeah. In your physiology, you will look at how the physiology of clotting and what actually happens. Yeah. So with septic shock, we have a clotting cascade, which basically is as a result of these bacteria, the release of these chemicals by these bacteria, causing or bringing about a coagulation. Yeah, even within the microvascular, system of the blood vessel. Yeah, leading to a systemic, vascular coagulation. So what are the threats? In other words, what are the problems? So with arterial thrombi, two potential threats, yeah? One of them is ischemia, yeah? Ischemia is basically when you have a blood vessel dislodging, yeah? This is what we mean, yeah? So when you have, assuming this is your blood vessel, yeah? This is your blood vessel. And then you have a thrombus, yeah? A thrombus lodges here, yeah? If a thrombus lodges here, that basically means, and blood was coming like that, yeah? That basically means that all this area, yeah? All this area will not be supplied, yeah? Because of obstruction here, yeah? So all this area will become ischemic, yeah? In other words, it is deficient of oxygen supply and nutrients. And as a result, it becomes ischemic, is the right word to use, yeah? So as a result, it can end up dying, yeah? It ends up dying and therefore becoming, necrotic, yeah? So ischemia, and also, basically creating ischemia, but also the second is the thrombus may dislodge, becoming a thromboembolus, yeah? That travels through vascular system until it occludes. Exactly, this is what we are saying, yeah? It might occlude a blood vessel, leading, to ischemia, yeah? So in other words, all this distal part, yeah, is not supplied, yeah? All that distal part is not supplied. How do we diagnose thrombi? Is usually accomplished through use of Doppler. Now, Doppler is also a radiologic investigation that you will find as you move on, yeah? So how do we treat these things? Usually we give what we call anticoagulants, yeah? Or thrombolytics, yeah? So medications like heparin, warfarin, yeah? These are referred to as anticoagulants. You will do them in your pharmacology, yeah? And things like streptokinase, yeah? These are referred to as thrombolytics. The difference between anticoagulants and thrombolytics is that anticoagulants, these ones, they help to prevent further formation of thrombi, yeah? While thrombolytics, for them, they help with splitting. In other words, they split this thrombus, yeah? They split it, yeah, and even dissolve it, yeah? Leading to its clearance, yeah? So that is what we refer, those are what we refer to as thrombolytics, yeah? Now, the other intervention that we usually do is that a balloon-tipped catheter can be used to remove and even compress the thrombus. This is what we mean. By the process of angiography, yeah, they insert a balloon-tipped catheter, yeah? So they insert a balloon in that area, yeah? And what it actually does is that when that balloon is inserted, yeah, it compresses, yeah? This balloon is inflated, yeah? It is inflated and it compresses, yeah? It compresses this thrombus, yeah? It compresses it so that you have, so that you have a patent lumen where blood passes, yeah? So that is basically how we do that, yeah? And so basically that is it about thrombus formation. Now I'm going to request you to read about emboli, yeah? I'm going to give you this presentation. Please read about emboli. When we come back next time, we shall look at another condition, and these will be valvular heart diseases. Yeah, that's what we shall look at next time. Yeah, please read about emboli, and also in case you need more information, please refer to the books that we are sent to you as far as the details of these things are concerned. Thank you so much for listening. Please make sure that you get this recording. Please stay home and stay safe. Thank you.